And I think that's the great thing about the show, where it improved complexity of the characters. So when you think about the influence of The Sopranos on pop cultures in terms of, like I said, where Tony, in spite of this hard exterior, is crying in sessions, is extremely vulnerable in sessions, is talking about his fears. I think it's really great to see. Prior to The Sopranos, you didn't really have that well-rounded thing. The Sopranos was legendary in the fact that it was shot like a film, the way it was written, even like I said, that session of the dream within a dream within a dream in season 5, which is powerful. Without that, there's no Inception. So it was just so ahead of its time.
You have found the Thinking Mind podcast. Hi everyone, welcome back to the podcast. This week it's a really cool episode where we talk about the psychiatric and psychotherapeutic themes in The Sopranos. We've got Dr. Akeem Sooley, who's returning to the show with another episode on arts and psychiatry. He's a consultant psychiatrist with a special interest in the things that we can learn from arts, things like music, TV, film, that can help us in our psychiatric practice. And we've got Dr. Omer Hammour, who's a core trainee in psychiatry in London and has worked with Dr. Sooley on this particular project. So you can expect lots of in-depth discussion of the types of psychotherapy and the elements of psychotherapy that we get to see happening in The Sopranos, some of the conflicts that we see happening, and really just an overall exploration of how the biopsychosocial model is used in The Sopranos to really deepen Tony Soprano's character. I hope you enjoy. This is the Thinking Mind podcast. Here you can access in-depth conversations all about psychology, psychiatry, psychotherapy, and self-development. Hi everyone, and welcome back to the podcast this week. We are super excited to welcome back Dr. Akeem Sooley onto the podcast to give us some more chat. Hello. So we've got Dr. Akeem Sooley, who's a consultant psychiatrist in Essex, joining us today to talk to us some more about TV and film. We've also got Dr. Omer Hammour joining us to also tell us about their thoughts and work in TV and film and the intersection with mental health. But welcome to the podcast. Thank you so much for coming back. Akeem and Omar, thank you so much for joining us.
Thank you. It's an honor. It's an honor to be back. We're super, super excited.
Thank you so much, Anya, for having us. It's an absolute pleasure.
And I guess as a disclaimer, heads up, I imagine we will probably be raising some spoilers for anyone who hasn't watched the show. Is that fair to say?
Absolutely. Tons of spoilers.
Yeah. So I guess for people who have maybe only watched Sopranos once, or who maybe haven't and have tuned into this vaguely curious, you know, what got you excited about it? What makes it, you know, not just a show about mobsters and, you know, just something that's about the mafia? What's got two psychiatrists interested in thinking about The Sopranos?
Yeah, well, it follows a middle-aged Italian-American man named Tony Soprano, who is a mafia boss in an organized crime organization. And he's actually, the series is actually advanced through his interactions with his psychotherapist. And so he's actually initially referred to his psychiatrist, Dr. Melfi, by his family physician after suffering debilitating panic attacks in response to a lot of different factors, life stressors, biological factors, as well as things going on around him. And Dr. Melfi accepts this referral despite Tony's checkered past, and she employs a holistic approach to his care. And The Sopranos is one of the earlier depictions of someone with a mental health issue that's portrayed accurately. And television is a medium that audiences can gain insight into the nuances of psychiatric practice, but it does depend on accurate portrayals. And The Sopranos, the show, has received critical acclaim from various different psychiatric bodies for its artistic depiction of psychoanalysis and the psychotherapeutic relationship. And so Dr. Akeem and I initially looked at season 1 of The Sopranos, and we were watching episodes and chatting to each other in between, talking about what sparked our interest, what sort of themes came up, looking at that biopsychosocial approach that Dr. Melfi takes. Yeah, so I'll just talk a little bit about each of those things, like the biological, the psychological, and the social. So The Sopranos coincided with the popularity of the serotonin theory of depression in the US.
Really?
Yeah, around sort of the late 90s, mid to late 90s. So that was a big theme in the show. And Tony's pharmacologically treated for his panic attacks, anxiety, and depression with various different medications, like an SSRI, Prozac to be more specific, as well as short-term benzodiazepines. And when it's realized that his depression is treatment resistant, he's put on lithium as well. And so this kind of sparked a thematic discussion around symptom control, medication efficacy, and adverse effects. And another thing is Dr. Melfi doesn't just prescribe willy-nilly. She takes the time to understand the psychological roots of Tony's symptoms and actually deprescribes when necessary. So as I said before, Tony had a debilitating panic attack when he was at his son's barbecue. He was seeing ducks playing in the pool. These ducks had a little family that he took quite a liking to. And he was happy, smoking a cigar, barbecuing, and then they fly away, and then he passes out. And he describes it as feeling like there was ginger ale in his skull when they left. This is what sort of prompts him to be referred to Dr. Melfi by his family physician. And he goes through the physical health investigations, including having an MRI done. And he describes it as Dr. Cusimano put me in hospital and had me get every test. And that's sort of the pathway into his treatment with Dr. Melfi. Once all of the organic causes are ruled out, then that's when you can sort of focus a bit more closely on more of a psychiatric presentation and a mental health reason for these panic attacks and for his physical symptoms. And he goes on to have multiple panic attacks, and he describes them as having shortness of breath, white spots in his field of vision, and he starts to understand how they work. And there's also discussion about side effects, so like loss of libido, and with the SSRIs, as well as emotional blunting while taking lithium. As I said before, Dr. Melfi doesn't just think about the biological, she thinks about the whole biopsychosocial model when treating him. And actually, towards the end of the first season, Tony starts to experience these pseudo hallucinations of a woman who, I guess, represents his mother in a sense, this Italian woman who only he sees. And when he realizes that he's the only person who sees her within his subjective space, Dr. Melfi sort of tries to get to the root of the issue and asks him to actually stop the lithium that he's taking and not continue it. And this is sort of in the context of Tony having lots of mommy issues with his sort of a love-hate relationship with his mom. But that's sort of scratching the surface on the biological psychoeducational benefits of The Sopranos and how it can be contextualized, how medication prescribing, deprescribing, and side effects profiles and understanding of when to prescribe and what to prescribe can be contextualized within TV. Yeah, so I'll let Dr. Akeem talk about some of the psychological or add on anything that he feels is relevant for the biological.
Okay, so I can see Omar's come with the smoke. So just in terms of what you said, Anya, in terms of why The Sopranos is such a good show, because generally you look at new TV shows, whether it's Dexter, whether it's Breaking Bad, those shows would not exist without The Sopranos. And we know Sopranos came into existence in 1999. So I guess the question then becomes, what sets the tone of The Sopranos? So we know there was a movie, I don't know, Anya, if you've heard of a movie called Analyze This. So that is a similar theme. In it, you have a mafia boss who is suffering from panic attacks and he gets treated. This mafia boss is Robert De Niro. and he gets treated by Billy Crystal, who is his psychiatrist. Now, the problem with this comedy is it's full of tropes about psychiatrists. I feel, if anything, it plays a lot on what a stereotypical psychiatrist is like. However, The Sopranos isn't like that. What sets it apart is you have Tony Soprano, who's working as a waste management consultant undercover, but he's a mafia boss. But we get to see this toxic masculinity in full display. So here is a mafia boss who is toxic masculinity on steroids. He beats people, he kills people, he does all sorts of things. He has a whole crew who have all these views on what a man should be. But we also see the softer side of him within these particular sessions. And I think that's very telling about it. Now, like Omar said, what's really important is in the 90s, we had a shift in how psychiatry was practiced in America. So prior to the 90s, yes, we had tricyclic antidepressants prescribed, but at that particular time, Freudian psychodynamic psychotherapy informed that was in place. However, with the discovery of fluoxetine in 1987 by L. Lilly, and with the serotonin hypothesis, there became this optimism about treating less severe depression with antidepressants, and there was an explosion of that. In fact, some people in America actually said this would be the death of Freud era, which, when we look at it, doesn't make sense at all. And so what we see with The Sopranos is that interface. What makes The Sopranos show very legendary is, like Omar said, even when you take the show by today's standards in terms of what we expect of psychiatry, it's well done. We see how Dr. Melfi treats him. We see her looking at the biopsychosocial aspect. So just to add on to what Omar said about the biological aspect, obviously you mentioned about the prescription of fluoxetine, but we also see depression in play. So Tony Soprano, she finds out from him about his low mood, he's feeling lethargic. We see periods where he's basically lying in bed, and we get periods where we know he's clinically depressed. So the fluoxetine, in my opinion, is treating not only a panic disorder, but also a depressive episode. The other thing we find out is when she takes the history, she finds out that there's a family history of depression. Because what's interesting, Tony Soprano talks about his great-grandfather who drove a mule off the cliffs in Avellino. And Tony Soprano basically discusses the soprano gene. So there's a recognition about the genetic nature and how depression can be passed on. But when Tony Soprano begins to use it as an excuse, blaming his son's AJ's behavior on the cursed soprano gene, she basically calls him to order. And I think that's very, very telling. I think that's really, really good that she's able to do that. So I think that's something very, very good in terms of exploring the biological mechanism.
I guess just to underline, is that the word? But that way of looking at things. So for anyone, again, I guess, who's listening, not from a psychiatric or psychological background, the biopsychosocial model is the way that we try to think about patients in medicine. And I guess what we're talking through now is the formulation work that as psychiatrists we often do. So when we meet a patient, this is exactly the kind of way that we'll try to think about what symptoms they're coming to us with. We'll say, okay, so I can see that, you're coming with panic, you're coming with low mood. Aside from understanding more about exactly what it is you're experiencing, let's really drill down into all the things biologically, physically, I guess, that could be happening. And like you've said, we understand that through someone's family history, so their genetics, also thinking about what might be chemically happening inside their brain. So when we're talking about the serotonin hypothesis, which I'm always nervous to say because it's such a controversial, well, controversial is not the right word. It's a little bit, isn't it?
Except if we go by Oliver Howe's recent paper using, I believe it was PET scanning, which seemed to bring it back, but bring back some of the tenets of it. But let's just say Joanna Moncrieff's paper trying to debunk the serotonin hypothesis has set the cat among the pigeons. But to be honest, that hypothesis is important to highlight. Wasn't very, very popular until obviously the discovery of fluoxetine by Eli Lilly It was put out in 1987. And it was actually Pfizer. When Zoloft came onto the market, it seemed to be a marketing strategy. Prior to that, academics, yes, they recognized a catecholamine hypothesis, but there was a more diverse explanation for depression. So I think with these things, they come around, like clockwork.
And actually from, the way that we're talking about it exemplifies how most clinicians think about depression, that yes, neurotransmitters and medication is part of the way to think about it. But of course, I think no one probably would believe that there's just a chemical shortage answer to something as complicated as the human condition that is suffering. But also recognizing, I think, something that a lot of people and journalists and so on have said recently is that message hasn't necessarily gotten across to patients. And a lot of patients have received what in reality is a shorthand, but has been portrayed and also marketed, like you say, Akeem, as a ground truth. And that obviously has been problematic in giving people this idea that all that is going on is something chemical wrong in their brain that they are powerless to do anything about.
Yeah, and that's something that Dr. Melfi actually addresses in the show as well, something I think she does quite well. So Tony, after a short while of taking his fluoxetine, comes into Dr. Melfi's office and says, I feel good. I don't think I need to come back anymore. And she actually, checks him and says, it's not the Prozac. The Prozac takes several weeks to build up effective levels in your blood. And Tony asks, well, what is it then? And Dr. Melfi says, well, it's coming here and talking, and hope comes in many forms. But obviously, Tony, being someone who's very results driven through his work, and I guess short-tempered as well, he wants quick results. But that's not really how caring for your mental health works. It takes lots of time and effort, and a conscious effort to create changes. And I think that's something Tony struggled with throughout the show as well. Every time he would be challenged by Dr. Melfi, he would sometimes throw a fit or storm out of the office, which is something that can be difficult to deal with. But I think that she handles that quite well and gives him room and space and gives him the benefit of the doubt as well. So I think that Dr. Melfi really acknowledges the fact that it's not just a biological fix. That you have to marry the two, the psychological intervention as well as the medication, and that's a really important aspect as well for people to see and to understand. And so, carrying on the psychological aspect of her approach to care, she elicits the fact that Tony experiences some cognitive dissonance in his life, and she asks him if he has any qualms about what he's doing or how he makes a living, and Tony replies, yeah, I feel like I have to be a sad clown, laughing on the outside but crying on the inside. And this sort of is an interplay between the Freud's id, ego, and superego, the id being the primitive aspect of us as humans, as Freud sees it, and the superego being sort of the moral conscience, and the ego wrestling between the two. And so Tony gives into his primal urges in terms of his aggression, sort of animalistic aggression, as well as sexual urges as well. He's being with many mistresses, but also sort of talks about what he thinks is right and how he knows what he's doing isn't that. And sort of there's an exploration of that within the therapy sessions. Throughout the sessions, the panic attacks are looked at from a psychotherapeutic lens as well, through symbolism. And I mentioned the ducks earlier, and it was realized that Tony, the ducks flying away was actually related to Tony's fear of losing his family. And that's something that he ended up coming to terms with, and through these sessions with Dr. Melfi. And there was also an allusion to the Rorschach test in the show as well. So one of the episodes referring to this fear of death, fear of loss. So in the beginning of one of the episodes, Tony is waiting outside of Dr. Melfi's office, and he looks at this painting of a tree inside an old red barn, and he notices that the tree is rotted out from the inside, but Melfi doesn't. And so Tony actually just likens it to the Rorschach test himself without Dr. Melfi prompting him to talk about that. But that's something that she explored regardless, and kind of likened his idea of the tree rotting out to his fear of death and loss, kind of like the ducks, looking at the symbolism of the tree. And I'll carry on a little bit more, if that's all right, just about the psychological aspect, because when you spend a lot of time with someone talking about hopes, fears, dreams, whatnot, there can be some transference and countertransference. So transference is when a patient sort of attributes another person in their life to their therapist. And speaking in a therapeutic context, it's more complex than that, but just, I guess, sort of my simplistic understanding. Tony likens his therapist, Dr. Melfi, to his mom quite often, and or to wanting that love from his mom that he never really got. And this is exhibited throughout their sessions together. Like when he asks Dr. Melfi where she's from, and she says, Caserta, part of Italy, that's close to where Tony's originally from. And he says, oh, my mother would have loved it if you and I got together. And he actually has a dream of, he has these recurring dreams that are very strange, but one of them is his therapist, Dr. Melfi, with her back turned to him. And when she turns around, it's actually his mother's face on her body. And Dr. Melfi actually kind of breaks that boundary as well, sometimes cracking inappropriate jokes and also telling him about her car troubles and things like that, which sort of leads to Tony feeling like they're growing closer, buying her coffee, and actually going up to kiss her at one point, at which point she has to stop and tell him that we need to take a little break. You can come back next week. But she addresses this issue by saying that, I've been a broad, sympathetic, generic woman to you because that's what this work calls for. And you've made me all that you're missing in your wife and in your mother, which Tony obviously finds very annoying, that she's not acknowledging their clear connection. But yeah, I thought it was an interesting to get to know how their relationship could cross that line and how she dealt with it and how she helped Tony through that. And also, I alluded to those pseudo hallucinations earlier, where Tony had these experiences of seeing a woman named Isabella, who was a caring version of his mother. And that's what resulted in Dr. Melfi asking him to discontinue the lithium. So she sort of attributes meaning to this fantasy, saying that the mother and the child, the Madonna, and Tony never actually flirted or came on to Isabella in a romantic way, despite her being attractive. And she challenged him, asking him, why the need for a fantasy of a loving and caring woman now? And that this kind of plays into his relationship with his mother, which we will come to. It's basically Tony's mother is a very difficult person to get along with. Her and Tony have had a lot of arguments throughout the show. Him being concerned for her well-being, being the only one of three children to be looking after her because she's cut ties with the other two, and her exhibiting signs of early stages of dementia, like leaving the stove on, forgetting how to use a phone, and running over someone with her car, wandering in the night. These really dangerous, precarious situations that she's found herself in. But there's also another aspect of that where you don't know if she's feigning those symptoms or if they're true. But I'll just let Dr. Akeem fill in any gaps that I may have missed.
Okay. So Omar's mentioned a lot about the show, and I think it's fascinating because as psychiatrists, one of the things we're doing is our treatment plan is biopsychosocial. So we look at biological factors, we look at medicine, we look at psychological interventions and treatment. But when we're looking at etiological factors, so when we're looking at causes for symptoms, for mental health symptoms, we do the same thing. Biological symptoms, whether that is inflammation, whether that is genetics, we look at those sorts of things. We look at psychological causes and we look at social causes. So just to elaborate a bit about Omar's point. So at a particular time, Tony Soprano is feeling very, very depressed. And then my understanding is Dr. Melfi ups his antidepressants. And then he has this, again, it's really difficult because it's very visual, whether you can call it a pseudo hallucination or dissociation or a response to the medication. Now, generally, when things like that happen, if you're not careful, people that just have a biological approach to looking at mental health problems, they become very, very biological in it. But what's great about her is she looks to meaning. And that's one thing we do at psychiatrists. It isn't just saying, oh, you might have a hallucination or a pseudo hallucination. But what does that mean? And that meaning is often personal to you. So this particular character, like Omar said, was a woman, Isabella. She was supposedly a dental exchange student from Italy. And she was very, very attractive. Now, knowing Tony Soprano was a womanizer, he doesn't flirt with her. It's a very platonic, very caring, nourishing relationship, for want of a better term. And then a scene towards the end of the pseudo hallucination, dream, or dissociative, or whatever you want to call it, is a scene where she's breastfeeding the baby. And Dr. Melfi asks him, what's the name of the baby? And he says Tony. And like Omar said, the interpretation is that this is a symbolic of the mother he wants to have. So this is a mother that is breastfeeding him and is good to him in some way. And I felt that was very, very powerful. Now, what triggered that? Was at a time where his mother was plotting to have him killed. So it's interesting that his way of dealing with it is to create this image. And remember, what Freud said is that there's a lot of unconscious things going on. So this is a very unconscious about the mother he wants to have. And like Omar said, this mother makes from when he was a child, makes very, very invalidating statements, verbally abusive, physically abusive as well. And his father isn't really there because his father is a mobster. So we see a lot of vicarious learning because his father discharges violence. And Tony Soprano has basically seen this go over and over again, has seen the violence. Now, what's very illuminating in terms of the psychological factors going on is when Tony has his first panic attack, because what Dr. Melfi is interested in isn't just the here and now, but what has happened in the past. And he makes reference to a scene where he has his first panic attack when he's a child. And Tony Soprano basically sees his dad go to a butcher, and this butcher is owing him money. And for those who are squeamish, his dad actually cuts the guy's finger off. And as a result of that, they get meat at a discounted price. And when Tony Soprano Jr. realizes that the meat we're eating in this house is as a result of my father discharging violence, he has his first panic attacks. He actually falls to the floor. And it's really interesting that because his son AJ has a panic attack when he's made captain of the football team. And so we see the origins of that panic attack, that when there's this conflict, call it a moral conflict or whatever. The other thing that's very, very interesting, talking about the psychological mechanisms and origins, is basically when she looks at patterns. So one of the things we're doing as psychiatrists, we're looking at patterns over and over again. So for those of you who are doing psychotherapy, there's this thing called Malan's triangle. And that's when you take a previous relationship and you interpose it on present relationship. So let me break that down on how it applies to Tony. So Tony Soprano, although his wife Carmela is mellow, she's really nice, caring, he seems to date women that are like his mother. So they can be very aggressive, they can throw things, they can be very invalidating, and there's just an edge to them. And Dr. Melfi points this out. And obviously when she does it, so like in psychotherapy, you know how you point something which is unconscious. And of course, Tony Soprano dismisses it. That sounds ridiculous. How can you insist I want to fall in love with my mother? And the good thing about this is, especially in psychoanalytical therapy, is how patterns in the past that relate to a child mother or a child parent that are repeated in relationships, either in therapy or in present relationships. And this is a powerful theme in the movie. This is something that was done. Remember, this film was from 1999 to 2007. Now we've got, like Silver Play Line Book. Is it Silver Play Book or the one by Bradley Cooper? We've got In Treatment. This was in 1999. So this is really groundbreaking stuff. The other thing that I think is really great about Dr. Melfi's approach is she invites his wife, Carmela, to the sessions. So when Tony Soprano actually admits that he's seen a psychiatrist, in Tony Soprano's world, the toxic masculinity means that is seen as a weakness. So obviously he doesn't want to reveal it. And he says to Dr. Melfi that by doing so, I'm at risk of getting an antidepressant bullet in the back of my head or something along those lines. Because first of all, he'll be seen as a snitch. The other thing is, and that wouldn't go well. But his wife describes it as gutsy. Now, when she comes to the session, she feels under attack. But later, she actually comes around and realizes she needs to be more supportive in terms of working with Tony and being more sympathetic with it. The other thing we see is as Tony progresses through, and remember, I wouldn't call it psychoanalytical psychotherapy, but it is informed in terms of a treatment. So as psychiatrists, we might not necessarily do psychotherapy, but we might take elements that we use to treat patients, which he certainly does. So we see some improvement. So first of all, there's some minimization in his anger. There's some people who annoy him. Now, the Tony Soprano of before would have basically have had them killed or murdered, but he actually kind of forgives them. He's more understanding about people with mental health problems. And we will discuss some of that more in terms of the social factors. And as a result of that, that kind of creates a dilemma for Dr. Melfi, because for people treating people with these psychodynamic psychotherapy or informed, sometimes they have to have their own therapy. And so what happens is they see another therapist. So Dr. Melfi is seeing another therapist, and there's a moral dilemma because she's being drawn into him. And her therapist mentions that maybe she's excited about treating a celebrity patient. And sometimes we need to look at our subconscious motives. What are we getting from that relationship? Because they're not always pure. And even if they're not necessarily pure, it's recognizing it because it helps us to be better psychiatrists. And the other thing that is noted in that relationship is the ethical dilemma. Because by treating Tony Soprano, she makes him a better gangster, which means he's more effective in killing people and committing crimes. And we see this ethical dilemma played out when she has talks with her own therapist. So I find that's really quite fascinating.
As you were talking, one of the things that really struck me and stuck with me, because I watched this before I'd really started psychiatry training, or sort of just at the very beginning, and I've since encountered some of these psychotherapeutic concepts. So now, hearing it and thinking back to watching the show, I'm like, oh my God, they did that so well. Particularly the bit of addressing, that moment where you can develop really weird feelings towards your therapist, or as a therapist, you can feel those weird feelings from your patient. And actually, they're not weird. They're completely part of the process of developing this relationship with another human being. Mm-hmm. But what you hope that your therapist can do is explore them with you. And like you were saying, Omar, like Dr. Melfi's able to, she's able to try to talk to Tony about it and try to get him to think about, what does it mean that you feel this way about me, a random professional woman for whom there's no reason for why you should be attracted or interested in me. Obviously, I think from memory, Tony, and like you said, Akeem, Tony's not the most open person to Dr. Melfi's interpretations. And there's a fair amount of just him not wanting to hear it and not wanting to go there. But sometimes he does take it on board. But in any case, just the portrayal of the transference, and also Dr. Melfi through her therapy exploring the countertransference, her feelings towards Tony, her response to how he relates to her, how he sees her, and how confusing that feels for her. And I guess highlighting that even her an experienced, we presume an experienced long-time clinician, still has to deal with strange feelings and thoughts being stirred up, and sometimes does that professionally and manages it through her own therapy, and I guess sometimes is human, and also it's a TV show and artistic license, so sometimes I guess you got to have drama.
It's really interesting about the choice because, Omar and I debated about what kind of therapy was she doing. So definitely psychoanalytical, psychotherapy informed. Obviously, she was treating him. But at one stage, when she felt it wasn't working, she suggested a behaviorist approach, which was very interesting in the sense that the techniques used were evidence-based treatment. We know, certainly for panic disorders, you can use psychodynamic psychotherapy. Yes, you can argue about the length of time she saw him, and the same thing for depression. But for panic disorder, certainly when she felt it wasn't working, she was prepared to refer him to a behaviorist, which would be like her behavioral interventions for a panic disorder. So what I liked was her ability not to be tied just to one school of therapy. And just to people watching it who might not, sometimes we have a preferred school of therapy. It could be cognitive behavioral therapy, it could be psychodynamic psychotherapy. And there's the danger that we can be so focused on that particular one that we don't take an eclectic approach. So the beautiful thing is that when you have training, being able to borrow from, even if you're not doing therapy, but being able to borrow from different therapies to treat the patient. One thing you notice with her, she works a lot on the unconscious, the subconscious, or whatever you want to talk about it. And she allows him to come to conclusion. So, for example, with the dog situation, when the dogs fly away, Tony Soprano actually comes to that realization that the dogs represent his family. You understand? But other times, although predominantly psychoanalytical psychotherapy, there's some guided discovery. So there's lots of, so why do you think the dogs meant so much to you? So you see some school of like cognitive behavioral therapy. I just think it's just so fascinating. There's just so many things you see in it, really. And the other thing that I think comes up very strongly, which I would love Omar to talk about, is his social network. So his mother, Olivia, his nephew, actually his wife's nephew, Christopher, Paulie and his friends like that, and their view about stuff. So I'm sure Omar would love to get into that.
Thank you for that setup. I mean, we've talked about Tony's relationship with his mother. That's been a recurring theme. And like you said, Akeem, Tony was never really supported or complimented growing up, and his mom constantly berated him. And her sisters cut ties with him a long time ago. And like you were saying, Anya, Tony's not really receptive to Dr. Melfi's sort of suggestion or interpretation of his relationship with his mother or how he's feeling until Tony sort of comes to terms with the fact that his mother was the one who put out this hit on him. And it was in the form of a carjacking. His mother was kind of sort of in cahoots with his Uncle Junior, who was the official head of their mafia, but Tony sort of ran things from the back. And they were kind of in conflict quite often throughout the show. So Livia and Uncle Junior conspired to have Tony killed. And Tony survived this attempt and actually got out alive. And that's when Livia kind of went back to her memory loss. And she has these periods of lucidity and kind of forgetting where she is. And so that's kind of the blurred lines between, is this really a true cognitive impairment, or is she feigning her symptoms? But I think she does do a great job of acting as if she did have her early stages of dementia. But as you said, he has a large network, and his crew, or his sort of right-hand men, are people who Tony confides in and can trust and do have his back. But Tony definitely felt difficulty in being comfortable actually going to therapy in the first place. And for that, and Dr. Melfi kind of explained the confidentiality process to him multiple times, but still the fear of having that secret of his come out to other people within his organization who might feel like he's talking about their wrongdoings and their criminal activities, might have him in grave danger. And that's actually one of the reasons that Livia put out this hit on him, is because she felt like he was talking about her behind her back. Sorry, and that sort of a commentary on the stigma of mental health and how they wouldn't have any qualms about him going into hospital for a physical health condition. In fact, one of Tony's associates, the previous boss, was in hospital with cancer, and that was a major stressor for Tony and a big reason why he felt low in his mood and hopeless. And everybody went to visit his associate Jackie while he was in hospital, but he was so secretive about going to therapy. And actually, Tony, throughout the show, kind of talks to the people around him in his circle, and also his mistresses, about life, about things that he wouldn't have normally talked to them about before he went to therapy. Like, he asked one of the women that he had an affair with, how's work? How's life? And she said, well, when do you ever ask me about work? And also when he was going on a drive with Chris Moltisanti, Chris is sort of having a rough time and says the regularness of life is too hard for him. And Tony actually elicits a biological symptom of depression from Chris and asks him if he's sleeping all the time, to which he says that's the only thing he still enjoys. And he says to Chris, I think you're depressed. But Chris says that he's not a mental midget, which it doesn't allow for further probing and further exploration of Chris's mental state. But Tony does ask the important question if he has ever thought about ending his life, to which Chris says no. And so Tony does a little bit of a risk assessment there, which is interesting.
The thing that from what you've talked about is the limits of connection that Tony's able to have with the people around him. So you talk about all these associates in the social network and the right-hand men who'd lay down their life for him, but to a point, none of it is, none of it is without condition. And then with Chris, that moment, that chance to actually have a really deep, meaningful conversation between them. And I guess, stigma and just the barriers around what it is for a man, a mob boss, to experience human emotions. They just can't allow themselves to have that connection or to acknowledge that reality. And that kind of limits Tony getting anywhere, right?
Very much
just
so.
As he's hitting upon something where he might change or something might get better. Yeah. He's kind of pulled right back in.
100%. And there was actually a moment during the show where Dr. Melfi suggests that maybe he needs to be admitted into an inpatient facility. And Tony says, do you have any idea what that would look like? And there's no way. And he says, try and get some guys to come to my door and see what happens, to try and take me away. So they have a collaborative approach to his care, and Dr. Melfi increases his antidepressant at that time. But there was another point towards the end of the show where Tony tells his crew about the fact that he's seeing a psychiatrist. So the people in his close circle, so Paulie, Silvio, and Chris Moltisanti, he tells them, I'm seeing a psychiatrist. I was passing out. They couldn't find anything, and she's been helping me with it. And so they kind of take some time to process it. And Paulie actually said that he was seeing a therapist years ago as well, and he had some issues, but now he's all set. Now he's got some coping skills. And Silvio mentions that, this thing of ours, where it's going, it would be better if we could admit to each other that these are painful, stressful times. But but he also acknowledges the fact that they're not those type of people that will talk to each other about those sorts of things. And Chris finally chimes in and asks, what is it, like marriage counseling? And Tony says, yeah, sort of. And then Chris sort of walks out. So there's this palpable discomfort in talking about their mental distress, mental health in general, mental well-being, and it's sort of shied away from, and they're very guarded when they're talking about it. But I think it was a beautiful scene just to see how they navigated that discomfort in showing their support in their own little way while still maintaining their hard man mentality. Something that Tony talks about at the very beginning of the show. What happened to the Gary Cooper type? The strong, silent type, the person who just kind of go about their business and not talk too much about it. But I think Tony realizes throughout the show that talking about things can be really helpful. And I think that him having worked with Dr. Melfi was really beneficial for his mental health. But then again, there's that ethical dilemma of, will that make him a better mob boss? Like Akeem said. I guess I'm yet to find out. I've got to watch the rest of the show.
Just talking about what Omar said about the awkwardness. There was another scene, sorry, spoiler alert for Omar, where his son AJ, because that's another theme about his relationship with his son. So AJ, his son, constantly has to live up with his dad being a mobster or a gangster. And AJ isn't your typical male figure. And so we see how that impacts AJ in terms of him having panic attacks. So when he takes a leadership role, like I said earlier, he basically has his first panic attack. And later on, when he has a breakup in a relationship, he becomes depressed. And he actually ends up trying to take his life. Hence, like I said, the family history of suicide, the great-grandfather riding the mule off the cliff in Avellino is brought up. But what's interesting is Tony is, again, with his crew and just says, let's just address the elephant in the room. My son tried to take his life. And then again, there's awkward silence. And they all start chiming in their controlled way of giving support by saying things like, well, my daughter had a problem with her eating. And then Tony says, but did she ever try to take her life? To which they say no. Then someone says, it's all these computers and the stress young people are. So there is support to some extent, but it seems to be limited. Another thing, and this isn't directly related to Tony, is Christopher, one of the guys, later develops an addiction to substances, mainly heroin. So it's very, very interesting in how when they get into a rehab facility, one of the things they do is they launch an intervention. So family members come, and the person who is launching the intervention says, look, just be mindful in how you do it. You need to say, Chris, your drug use does this to me. So when you use heroin, this is how it affects me, which is very, very NA oriented, because we also see him get sponsors and all that. But there's a time when Paulie loses with it and says, you're weak, you're an embarrassment, So we see that. We also see in terms of stigma where Tony actually in therapy talks, although he never says it to AJ's face, about how he's ashamed and embarrassed by him. You understand? But it's really great in terms of seeing social networks. So as psychiatrists, one of the things that can affect our access to treatment, how we look at mental health problems, is our social network. So that's one thing we do. What do our friends think about it? Will they help us? Will they support us? I think that's really, really, really important.
Because the reality is the time that you spend with your Dr. Melfi or equivalent is a couple hours a week or whatever. And it's the rest of your life where you're trying to make sense and deal with what you're going through. And the people that are there with you are the crucial part of that. And I guess we see with Tony how difficult it is, because the people around him, and also with Christopher, because again, the people around them are up to supporting them to an extent. But then, so for instance, with Christopher, after he finishes rehab and is trying really hard to work, to deal with and work with his addiction, but everyone around him just gets a bit wound up. And whilst on paper they say, yeah, we want to support him, when they're faced with the reality of, okay, so that means he might need to not go to the places that he used to go to. You might need to have meetings not in places where there's loads of alcohol. You might need to go for dinner with him without drinking and having access to drugs. And the people around him can't really be bothered. And that's, again, without that social network and without that social support, I guess Chris shows how hard it is to maintain a change that actually he really tries, really wants to make.
So as psychiatrists, we look at relapses. Sometimes the social environments we are, the friends we hang out with, can sometimes impact on whether a person has a relapse of their mental health condition or when they have a substance use disorder. So inquiring about that helps it. And sometimes one of the things you need to think about is about how you choose protective environments. So taking Anya's point, where Christopher is in an environment where, like I said, in terms of meetings, on one hand, they seem to be supportive, but then they put him in positions where they basically imply that because he can't control his drink, he has a problem, that he should be able to drink and control it. And he goes by the Narcotic Anonymous AA tenets that, that I have a disease. So if I have one drink, it causes a problem, really, So lots of interesting things, not just on Tony, but also, the other members there, So that's really, really interesting.
Yeah.
Yeah.
I just wanted to mention, there was also a really sensitive topic in the first season where Meadow, Tony's daughter's friend in her soccer team, is self-harming, and it goes through the process of reporting that and the reasons for why she self-harmed. And there's a lot of different psychiatric elements in the show. Yeah, like Akeem said, not just for Tony, but for many of the characters, his son in later seasons, Chris, and I think it's a really effective way to shed light on mental health issues and normalize them in a sense, so that we're not like Polly and Chris and Sylvia when we're talking about them.
Absolutely.
And it brings a really, I think you talked about cognitive dissonance at the start. We feel Dr. Melfi's conflict in some ways as well, because we see Tony do these horrific things, but because of the rounded way in which the show portrays him, and because of having all this inquiry into his personality and his roots and his development through Dr. Melfi, you see that he is a complicated human being he's not like just a baddie in the way that I guess obviously nobody is. Everybody has a way that they've come to be how they are, and then that's a little bit, I guess, at odds with some of the portrayals that we have in society of people who have done crime as, all you see is the crime. But with Tony, it kind of makes you question, I definitely felt sorry and felt sympathy and kind of wanted him to have a better life at times, even though he'd be like murdering and doing really difficult things as well.
And I think that's the great thing about the show, where it improved complexity of the characters. So when you think about the influence of The Sopranos on pop cultures in terms of, like I said, talking about toxic masculinity, and someone where Tony, in spite of this hard exterior, is crying in sessions, is extremely vulnerable in sessions, is talking about his fears. I think it's really great to see. Prior to The Sopranos, you didn't really have that well-rounded thing. The Sopranos was legendary in the fact that it was shot like a film, the way it was written, even, like I said, that session of the dream within a dream in season 5, which is powerful. Without that, there's no Inception. So it was just so ahead of its time. And to the millennials, I know my daughter always talks about Breaking Bad. Without The Sopranos, there's no Breaking Bad, there's no Dexter. That influence of where you have a character and you're dealing with his family and all those little bits, The Sopranos did bring that, really did bring that up. So, and I would just encourage, because I know sometimes when you see a lot of the new TV shows now, it's very fast-paced, you understand? Whereas TV shows like The Wire and Sopranos, you need to invest. So I was reading something on like some of the blog sites where they were talking about some of the newer generation, because a newer generation is being introduced to The Sopranos. They said they were skipping the sessions with Melfi. And this writer was saying the importance that Melfi sessions is really important to have an explanation of why Tony is the way he is, why he behaves the way he is. Because when you have the way TV is consumed nowadays, people want fast pace, they want scenes changing, a bit like the Breaking Bad. And that's why Breaking Bad appeals to a lot of people. Whereas TV shows like The Wire and Sopranos, where it takes time to build the characters and you really need to invest. That's why some of the, I don't want to say newer generation, but some people find it difficult to get into. But definitely a legendary show. HBO are definitely on a winner with that. With that. And just to say, for Omar and I, we've actually done some poster presentations. So it's really great to see, this out there. Strongly recommended for resident doctors, for psychiatrists, for the viewing public to know more about mental health.
Highly recommend. As someone who just recently started to watch it, it's one that I have gotten hooked on. But although it's sort of, I've been watching it in a sort of a different lens, in a more analytical lens, it's still just as enjoyable and very informative and educational as well. So there's a lot of potential there for this show and many more to come as well.
And for those of the reading, there's a book by Glenn Gabbard. So Glenn Gabbard is a psychotherapist / psychiatrist called The Psychology of the Sopranos. So there's a book about where, we didn't bite from it, but just for people to know there's a book out there about it.
Nice. So if anyone's interest has been piqued, then they can get their fill even more.
Absolutely.
What are you guys excited about working on next, or where are you looking? Because I know you've always got lots of things on the go.
Yeah, this is something that I briefly mentioned to Akeem a little while ago, but I watched this TV show named Rami, and it looks at the story of a 20-something Egyptian-American male who lives in New Jersey. So he's part of the diaspora. And the first 2 seasons sort of contextualize his situation, but the third season has a heavy emphasis on mental health, especially in the Arab American person, sort of understanding identity and dealing with difficult emotions, and similarly to the Italian American mindset of the stiff upper lip. That's sort of how Arab people I've found to perceive mental health. And coming from Sudan, North African country, it's similar. So I think that show really explores that nicely, and it's something that I'd be interested in thinking about in sort of the same way I've thought about The Sopranos.
And for me, many shows, Euphoria has to be tackled. I'm just thinking there's so much. Euphoria is so dense, so it would definitely need to be tackled. There's a TV show that is called Dope Sick, and that basically explores with how the opioid epidemic started. Although that's very interesting, because looking at it from a racial lens, you see it's treated as a public health disorder, but that's not what happened when we had the crack epidemic. So that's one thing to look at. And another thing, since Omar is bringing up Arab stuff, there's a Nollywood movie called The Grill, which is very interesting, and it deals with this storyteller, but because he's so shy, he actually tells his story to his friends and how he navigates that. But what's very interesting in that story is this guy has a social anxiety disorder. It's clear. You can actually diagnose it. He has a social phobia. And a lady whom he likes actually helps him using CBT techniques. It's really good. Because a lot of Nollywood movies, sometimes they're like particular themes they cover. That's on Netflix. So there's just so many things there. And just to say about The Sopranos, there's a medical student, she should be graduating. Shout out to Ladantai, who is actually looking at The Sopranos, and she's basically looking at stereotypes. Because when you look at The Sopranos, the depiction of Black people there there are lots of stereotypes, and hopefully LaDanta might be able to do a talk, but she's got a poster at the International Congress where she talks about those stereotypes. And talking about stereotypes of The Sopranos, a good number of Italian Americans didn't really like it. They've always felt that there's too much focus on, mobs and the mafia. And as Italian Americans, and you sometimes see that in the theme where Dr. Melfi is speaking to her husband and he's going on and on about the mafia and America's fascination with the mob and stuff. And also the way the Jews are portrayed in it. So being honest, we have to be mindful. There are some stereotypes there. So not everything in the TV show is good, but we're just highlighting the things that we find helpful.
Anywhere else that people can either hear more from you, or if anyone's interested in kind of hearing more about your thoughts, is there anywhere that we can direct people to?
Okay, Twitter. You know me, Anya, on Twitter. You can follow me on Twitter at AK411CAM. At AK411CAM. Holla, Richard Boy. I said that with my Jay-Z laugh. Sorry, Omar, are you on Twitter?
I am, but I don't tweet much, to be fair. But you can still find me on Twitter. It's at @_Omarati, and that's actually my stage name as well. I do music. I do a little bit of music on the side, so you can find me on any streaming platform.
And his music bangs. His music slaps, as the young ones say. His music slaps.
Is that the thing to say now?
Yeah.
Sorry, I'm making notes.
Music slaps.
Thank you both so much for coming to speak to us. It's, as always, been fantastic and just really fascinating, and hearing your insights and the way that you've thought about shows that I love. Is there anything that we have missed, or any important things to say before we sign off?
Just to give you your flowers, Anya, thank you for the time, and thank you for having us, and thank you for the thought-provoking questions and this opportunity.
It's a huge pleasure.
And again, just to echo what Omar said, mostly podcast, you're doing such a great job. And we just like the variety of stuff. I've spoken to a lot of people. They really enjoy your podcast. So thank you so much for reinviting me. I felt under pressure. I told Omar, we really need to bring the smoke, because, Anya's standard team, it's quite high,
No, never need to be nervous, but thank you very much for the kind words. It's very, very much appreciated, and hopefully see you again with whatever your next work brings. Thanks so much for listening this week. I really hope that you enjoyed listening to Dr. Soulé and Dr. Hammond talk about the psychiatric and psychotherapeutic themes in The Sopranos, with a particular focus on the first season, but going beyond that at points. If you've got any feedback, as always, do get in touch. If you enjoyed the episode, why not give us a rating on Spotify or Apple Podcasts, because it really helps other people to find us. If you want to get in touch, you can find us on Instagram or Twitter, or you can drop us an email. And if you value the show more generally, why not buy us a coffee just to help keep us going? Thanks so much.